Depression is something that just doesn't go away. It's just, there's something you deal with. It's like malaria or something. Maybe it won't be cured, but you've got to take the medicine you're prescribed to stay out of the situations that's going to trigger it. Depression is emotional and physical problems. Typically, people with depression find it hard to go about their day-to-day activities and may also find that life is not worth living. Diagnose depression, your health care provider will ask you questions about your symptoms and family history. You may be asked to fill out questionnaire about your symptoms. A person has about 1 in 7 chances of developing depression in the course of his or her lifetime, and about 1 in 25% chance of suffering from it to this very point in time. This condition is feeling the baby blues. Feeling sad, anxious, or afraid or confused after having a baby do not go away or get worse. Depression is a serious illness affecting approximately 15 out of every 100 adults over the age of 65 in the United States. The disorder affects a much higher percentage of people in hospitals and nursing homes. When depression occurs in late life, it sometimes can be a relapse of earlier depression. Researchers are looking for better ways to understand, diagnose, and treat depression among all age groups of people, studying strategies to personalize care for depression, such as identifying characteristics of the person that predict which treatments are most likely to work, and is an important goal. The biggest discovery of treatment of depression is rapid. It produces within hours antidepressant actings in patients who have failed to respond to other antidepressants. It is a term used in clinical to describe cases of major depressive disorder that do not respond to standard treatments. For many people, antidepressants treatments or talk therapy, such as cognitive behavioral therapy, ease symptoms of depression. No, lack of sleep cannot alone cause depression, says Dr. Yamandala of the Missouri Depression Industry, but it also can play a role. Lack of sleep resulting from another medical issue or the presence of personal problems can intensify depression. Chronic irritability to sleep is also an important clue that someone may be depressed. Depression is highly familial. When a patient has depression, a child faces 3 times the risk of becoming depressed compared to the child without depressed parents. If a parent developed a mental illness before age 20, the child's risks 4 to 5. Yes, depression is serious but treatable mental illness. It is a medical condition, not a personal weakness. People who have depression should not be treated differently just because they have a mental illness. Just remember to think before you act.